Paynesville Area Healthcare System serves the communities you live in. With medical clinics in Belgrade, Cold Spring, Eden Valley, Paynesville, Richmond, and Spicer, you are sure to find personalized care close to home. We truly are a small system with big services.
I'm Dr. Kurt Habben. I grew up in Paynesville, graduated in '99 from Paynesville High School. From there I went to Gustavus for 4 years and graduated with biology, chemistry, and biochemistry majors, and went directly to the University of Minnesota Medical School, where I graduated in 2007, and from there went to Duluth to do my residency for 3 years, where I worked at both of the hospitals up there, St. Mary's and St. Luke's, and we had our own residency clinic. And from there, upon graduating this past July, came down to Paynesville Area Healthcare System and working in Richmond. I'm married. My wife is Kara. She's a mechanical engineer by trade. Right now she's a stay-at-home mom. We have a son, Parker. He's 15 months old, and she's 3-4 months pregnant right now too, so another baby on the way. And it's nice being in a new community for my wife and I can kind of go through the same experience of trying to kind of settle ourselves and immerse ourselves in the community and meeting people. But I'm really committed to rural healthcare. I think as a general practitioner, as you get to the more metropolitan, you kind of get hedged in as far as what you do and how valuable you are to the patients. Where out here, you really can make a big impact in people's lives. Where it's not specialty driven, you really get to know the soul of the person, the actual person, instead of just the medical system that you're concerned with the problem. I enjoy them. It stinks when you see a sick kid, and I'm pretty empathetic to the parents. That can be really hard on. They definitely take a different style to try to kind of connect with them. And there you have to be a little more adaptable than probably more so than other patients, where with adults or older folks you can kind of take the Stearns County approach and kind of shoot the bull a little bit, and that definitely you need to work at it to gain kids' trust in the acute sense and in the long term, because they're freaked out. They don't know what you got with the stethoscope, and that you're just going to listen, and you're putting stuff in their ear and looking in their throat and kind of talking with them and showing that mom or dad trusts me and that it's okay, and letting them, just little things that you pick up, like examining them on their parents' lap is a lot more comfortable than sitting alone on the examination table. Definitely, if there's an option and the patient's concerns lie in alignment with that, less drugs are probably the better. I try not to recommend starting a medication unless I have pretty good evidence that it'll be beneficial. But I also try to talk with the patient about, with any medication that you take, there's benefits and there's risks to doing that. And trying to clearly let that inform them so they can ultimately make the decision. There is a recommendation that comes from me that carries a lot of weight, but I really try to do my best to present the information for them. I'd say our clinic is a great local resource. It's nice to doctor and get your health care where you live and work with people who you live among. The staff here is great, ranging from the receptionist to these nurses that are great, and my colleagues, and that, I'm from the area. So I know kind of the one of us that's kind of the big Minnesota thing, I think is a benefit, and I'm really trying to become kind of immersed in part of the community. So, and we have a great healthcare system.
We truly are a small system with big services.